Hello viewers, today's topic of discussion is, am I getting a heart attack or a panic attack? In my practice, I have seen a lot of patients who suffer from anxiety disorders. When they have severe anxiety problems, they may develop what is called as panic attacks. These panic attacks can very much mimic like a heart attack. This can be very scary and terrifying for patients to handle. Therefore, when they suffer from repeated panic attacks, they develop extreme fear that they have a serious health problem like a heart attack or a stroke, and therefore they see different kind of doctors like a cardiologist who is a heart specialist, a neurologist who deals with problems in our nerves, and a gastroenterologist who deals with our gastric problems. But the fact is, you need to see a psychiatrist because panic attacks occurs due to extreme states of anxiety and it is a psychological problem. Let me explain what are the symptoms of a panic attack. When people suffer from significant panic attacks, they often complain of pain in the chest, tightness in the chest area, difficulty in breathing, fast heart rate also called as palpitations, and some kind of tingling sensations in the arms and shoulder. All these symptoms mimic like a heart attack. Therefore, they are extremely worried that they are getting a heart attack and they would like to see a cardiologist and get advice regarding this. However, it is not caused by heart attack, and the panic attacks are caused by scary thoughts in your brain. Some people experience headache. They are kind of more atypical headache with pain in different parts of the scalp and also in the forehead. Some of them complain of giddiness and dizzy spells. People may also have shakiness in their hands and legs. Therefore, they assume that they suffer from some kind of nervous problem and would like to seek consultation from a neurologist. Some people have churning sensations in their stomach. They may also have pain in their tummy and complain of acidity. Some people go to the toilet repeatedly, either to pass urine or pass stools. All these symptoms would make them think that they have some problem in their stomach and intestines, and therefore they would like to seek opinion from a gastroenterologist. But what you need to understand is, you don't have any major physical health problem. What you're going through are all symptoms of a panic attack, which is an extreme state of anxiety. Let me explain why people suffer from panic attacks. Often people suffer from multiple stressful life events which can make them feel extremely stressed and also anxious. When such anxious thoughts last for longer period of time, these can lead to panic attacks repeatedly. However, in majority of the patients, the panic attacks occur out of the blue and there may not be any reason or cause for sudden panic attacks. This causes more fear and extreme levels of anxiety. Now, I would like to give a scientific explanation as to what happens when someone gets a panic attack. When you have a panic attack, your mind makes a serious mistake and turns your adrenaline tap on full. It's important not to worry about it, and you will run out of it in half an hour or so, as you only have a 30-minute supply of adrenaline. Therefore, your racing heart, chest pain, difficulty in breathing, churning stomach, and all these symptoms will settle down soon, maybe in half an hour or so, even if you do nothing. However, people don't realize this. They panic, and the more they panic, the adrenaline secretion goes up and can even last longer in the body. Now, you may think adrenaline is some kind of bad chemical, but that is not the case. Adrenaline is a chemical which is produced in the body whenever we go through stressful life situations. And this chemical also helps to face that stress effectively. For example, say you're taking an examination. Before you go into the examination hall, you are under stress. The body will secrete adrenaline. So when adrenaline is produced, people may have sweating, increased heart rate, shakiness in their hands, and all these kind of symptoms. But after you enter the examination hall, say after 30 minutes or 1 hour, these symptoms would come down and you will feel normal. This is because the adrenaline tap can only last for 30 minutes and it stops automatically. So you need to realize that the same thing happens during a panic attack, but because it occurs out of the blue and you're not going through any stressful situation at the time, it causes more fear and you worry that you may be suffering from some kind of serious medical health condition. Next time when you have a panic attack, you need to remember 3 important points that I'm going to say. Point number 1, you need to reassure that you're only having a panic attack, which is a form of severe anxiety attack, and you're not having a heart attack. Point number 2, you need to remind yourself that the adrenaline tap is open and the secretions will last for 30 minutes to 1 hour. After 1 hour, this tap will close automatically even if you do nothing. Point number 3, you should also ask yourself, last time when I had the panic attack, nothing happened, I did not die and I was fine. Similarly, this time also, after having this panic attack, I am going to be fine and nothing terrible will happen. So if you remind these 3 important points every time you have a panic attack, then you may be able to manage these attacks more effectively. Lastly, and most importantly, panic attacks can occur again and again, and this can be very distressing for the person who is experiencing it. So if you have repeated panic attacks, it is important that you go and see a psychiatric doctor and get medical advice. There are a lot of tablets and treatments available for panic attacks these days, and these medications are helpful to bring down the frequency and severity of such panic attacks. You will have to take them for a period of 4 to 6 months, which will help to bring down the anxiety levels in your body and the panic attacks can disappear completely. I hope you found this information useful. In order to watch such health related videos, please subscribe to our YouTube channel, Psychiatrist Prathap, and also make sure that you click the bell button on the right hand corner for notifications. Thank you for watching.